Let's talk about circumcision, the removal of the foreskin, a common surgical procedure in the U.S. that is usually performed on infant boys within the first few days of life. Originally started to prevent masturbation. Why do some parents choose to circumcise their boys? Many parents believe the myth that circumcision is cleaner and prevents infections or complications later in life. Others prefer the way a circumcised penis looks. Yeah, if you're thinking that last sentence sounds weird, it's because it is. Carving your personal preferences into your newborn baby's penis is wrong. I'm here to give you some information that could change your whole outlook on infant circumcision. This is not intended to shame any parents or offend anyone. But this information is extremely important to know. If this information enrages you, it directly reflects to your own personal feelings about the choices you've made. If you're willing to accept and acknowledge this new information, you should be proud of yourself. That's a symbol of growth and love. Okay, so let me paint a picture in your head. You're pregnant. You find out you're having a boy. You're so excited. You and your husband wanted this for so long. You start planning for the baby's arrival by picking out soft blankets and clothes, researching which car seats, cribs, and strollers are the safest and best option. You read parenting books and go to birthing classes. You study everything you can possibly think of that comes with having a baby, except circumcision. Your husband is circumcised and he thinks your son should be too. Everyone you know is circumcised and tells you that it's cleaner and prevents infection. It's just what people do, so it's the right choice, right? You don't put much thought into it. The time comes when you're in labor and it's time to have your baby. Next thing you know, you have this perfectly created little human lying on your chest. Your heart is exploding with a love that you never thought was possible. You're thinking, how could I create something so perfect? You can't keep your eyes off him. You have this instant feeling of love and protection. You know that you'll never let anything bad happen to your baby. The doctor comes in to check on you. He asks, "So, are you going to have him circumcised?" Your husband quickly says, "Yes." You have some hesitation. Your heart drops into your stomach a little. Something in you is telling you that this isn't right. But you know your husband wants this, and plenty of babies get circumcised every day and they turn out fine. So you suppress your natural instincts and agree to the procedure by signing your name on the consent form. The nurses come in to get your baby for his circumcision the next day. You nervously hand him over. You keep telling yourself, this is what's best. The nurses encourage you to stay in the room instead of watching the procedure. You're not sure why, but you agree and give your baby a kiss on the forehead before he leaves. I'll stop there. The outcome of what's ahead for this sweet baby is undetermined, but over 117 babies die every year from circumcision. Many have serious lifelong complications. Some come out of the surgery just fine, except for they are missing a functional and beneficial piece of their perfect little body. The body that your body spent 9 months perfecting. And trust me when I say that your body made no mistakes. This baby was forced to have an essential part of his penis amputated for absolutely no medical need whatsoever. He may want that part of his body back one day. What happens during infant circumcision is horrific. There's a reason mothers are told to stay behind, because they wouldn't be able to handle watching the torture their perfect baby boy has to endure. The doctor and nurses strap the baby down by his wrists and knees to a cold and hard plastic board called a circumstraint. Usually just the feeling of the cold plastic against the baby's brand new and soft skin is enough to make him cry. The doctor must manually stimulate the baby's penis. Usually this is done while putting on the antiseptic used before surgeries. Yep, that means that this infant now has had his first erection. Some doctors, although very few, use a local anesthetic to help with the pain. Most doctors don't bother because the anesthesia is so ineffective and takes too much time. Baby boys do feel this excruciating pain during circumcision. The doctor then has to forcefully rip the foreskin from the glands, clamp the foreskin, and slice it off, leaving an open wound that will be exposed to urine and feces in his diaper. Many nurses report that the baby screams the entire time, often loses his breath from screaming so hard and chokes. They shove a pacifier dipped in sugar water into his mouth. Some babies pass out from the pain and go into shock. Their little bodies just shut down. I am not lying about this. After the procedure is done, the nurses bring the baby back to mom and tell her, "He did great. He slept through the whole thing and took it like a champ." Because what mother wants to hear that her baby choked and turned blue from screaming so hard? An infant did not take the most sensitive part of his body being brutally ripped apart and sliced off like a champ. He had no choice. He was forced and strapped down so that his penis could be mutilated by an unethical doctor. And the only voice he had were his screams that were muffled by a pacifier dipped in sugar water. That unethical doctor then sold this baby's foreskin, which contains fibroblasts, to cosmetic companies that use fibroblasts in their face creams and anti-aging products. This doctor is taking advantage of his medical degree to convince gullible parents that circumcision is necessary. And then he's cashing a check for it. After all, doctors are supposed to be the people that we can trust. Now I want to give you some information about foreskin that you may not have known. The foreskin is an extremely beneficial organ of the penis and has many functions. In infant ears, the foreskin acts as a protective layer. The foreskin is fused to the head of the penis. This means that it is non-retractable. This is to keep out contaminants that could cause infection, such as urine and feces. During circumcision, the foreskin is removed, which then leaves an open wound exposed to infection-causing bacteria that once had protection. The foreskin will remain fused until as late as puberty for some boys, but every boy is different. At that time, natural separation happens and his penis will become retractable, but should only ever be retracted by the boy himself. This means that parents never have to pull back the foreskin for any reason during diaper changes or bathing. If you try to pull back your son's foreskin before natural separation happens, it is called forced retraction. Forced retraction hurts because the foreskin is being ripped from the glands of the penis, which is part of the process of circumcision, and can lead to infection. Diapering care for an intact newborn boy is as easy as it gets. You simply wipe the penis from base to tip, and that's it. Unlike diapering care for a circumcised baby, which consists of watching for infection, applying petroleum jelly to the penis until it keratinizes and dries out, and pulling back the remnant skin to clean it. Many people do not know that the care for an intact infant is so easy and that they never have to pull back the foreskin. And once natural separation happens, it takes an extra 2 seconds for boys and men to properly clean themselves in the shower. It's as simple as pulling back the foreskin, rinsing with water, and returning the foreskin. Boys are more than capable of washing themselves in the shower. Just because they are boys doesn't mean they're stupid. Not to mention, circumcision doesn't mean that men automatically don't have to wash their penis. Regardless of if a man is circumcised or intact, he will still need to shower to stay clean. The U.S. is the only country in the world that performs routine infant circumcision. 70% of the world's population is intact. When people from other countries hear what America does to their baby boys, they are horrified. So why is it that intact men in other countries live a long life with no problems or issues with their foreskin? But in America, the foreskin is seen as a self-destructing organ. Well, it's because we have been surrounded in the midst of a cutting culture. Doctors, nurses, and other healthcare workers in America are extremely uneducated about the foreskin and its proper care. Remember how I said the foreskin is never to be retracted until natural separation happens? Well, it was once believed that by doctors in America that it did need to be forcibly retracted. This means that it is not the foreskin itself that is the issue. It is the care being performed by uneducated people who have only ever been taught to cut the foreskin off, but never taught about the foreskin itself. More parents every day are being exposed to the truth of circumcision and choosing to leave their boys intact, which is resulting in more education about the proper care of an intact penis. This means that intact men in America will go on to enjoy their intact penis their whole life, just as intact men in any other country. Every single mammal in the world has foreskin, including women, known as the clitoris. Female circumcision was legal in the U.S. until 1996. Can you believe that? If you're a female in America, could you imagine your parents choosing to have your clitoris removed as a baby? It doesn't seem very ethical though, right? But yet, some are still choosing to do this to their baby boys. The clitoris contains 8,000 nerve endings. Guess how many nerve endings a male's foreskin contains? 20,000. That's 12,000 more than a female's clitoris, just to put it into perspective. Circumcision removes the most sensitive part of the penis, leaving men with reduced sexual pleasure. Speaking of sexual pleasure, that's another function of the foreskin. The foreskin has natural gliding and rolling action that reduces friction and vaginal dryness, making sex more pleasurable for both partners. There's even no need for lubricant. Sex with an intact penis is exactly the way nature intended. Infant circumcision robs men and their future partners of their sexual pleasure. In conclusion, the harms of circumcision are very real, and ignoring them is plain ignorance. It is a completely unethical and unnecessary procedure that is performed on the most innocent and defenseless human beings against their will. It is the only surgery where amputation is performed before treatment for a problem that hasn't even arisen and most likely never will. Circumcision has been proven to have absolutely no medical benefits, does not prevent against any infections or lower odds of penile cancer. The foreskin is a healthy, functioning, and beneficial part of the penis, and it is the most sensitive part of the penis. Caring for an intact baby is easier than a circumcised one. If intact, never retract. And men are more than capable of washing their own bodies. Foreskin requires almost no extra time or care. A newborn baby should be loved the way he is. He is perfect and his body requires no disassembly or modifications. He should be welcomed into this world with love, affection, and protection, not restraints, clamps, and a scalpel. His genitals should never have to bleed or have to heal. Being able to permanently alter another person's body without their consent or any medical need is not a parenting choice. It is not a matter of opinion. It is not personal preference. Infant circumcision is a violation of human rights and bodily integrity. He may be your son, but it is his body. It is his choice to make.